In previous video, we discussed about static assessment. In this video, we will proceed with dynamic assessment of lower limb. The single leg stance test is a fundamental assessment for lower limb balance and proprioception. It involves standing on one leg and can be performed in three variations: eyes open, eyes closed, and single heel raise. Progression include maintaining balance for at least 20 seconds and using challenging surfaces. Single leg heel raise test focuses on tibialis posterior function, which is crucial for controlling foot pronation, stabilizing the plantar arch, and inverting the subtalar joint. If you notice difficulty rising through the medial foot or inverting the rear foot during the test, it might indicate weakness in the tibialis posterior. Arch form test evaluates intrinsic tibialis posterior control during gait stance. Patient lifts the inside arch while pressing the first metatarsophalangeal joint into the ground. Clinician monitors with a finger under the joint for adequate pressure. Target is to maintain position for 10 seconds. Single leg squat test is used to assess knee, hip, and trunk muscle functions. It is a part of progression for lower limb biomechanical assessment. Variations include depth, for example 45 or 60 degrees of knee flexion. Arm position can be crossed or hands on hips. Unsupported leg posture, which is either in front or behind. Clinicians should use a consistent approach for reliability. Trendelenberg sign is indicated by pelvic drop of uninvolved side, hip abductor weakness, waddling gait, and trunk compensation. Knee assessment includes checking for knee alignment, that is, does the knee center align with the foot center. Patellar position, knee deviation, which can be valgus or varus as discussed in the previous video. Patellofemoral assessment. Landing assessments are crucial for athletes, especially for detecting anterior cruciate ligament injury risk. Single leg landings are ideal for those with lower limb injuries, example patellofemoral pain, while double leg landings suit recovery phases post injury or surgery. Drop landings from a platform can highlight reduced knee or hip flexion, excessive knee valgus, heavy landing patterns which are linked to higher injury risk. Consider pre and post exercise evaluation because fatigue increases knee abduction and reduces knee flexion. Video analysis can elevate the precision of your assessment, enabling slow motion replays and accurate measurement of movements like knee valgus.